Hi, I'm Rob Cronin. Welcome to 120/80's Vital Conversations on Technology and Healthcare. We just finished our panel on innovations in primary care, moderated by Lisa Suennen. Let's take a watch of what the panel and Lisa had to say.
I have some amazing people to my left who will be talking with lettuce in their teeth probably, but that's okay. But are the physicians in your system trained to really, look at the behavioral health aspects, to look at, all of the different things that might not be so obvious in a primary care type of setting? Are they really equipped to know when they should refer versus keep?
Oh, well, behavioral health, since you mentioned it, Lisa, is probably the number 2 diagnosis amongst medical patients.
What about you guys? How on the pediatric front? Because most kids, right, they're healthy, they don't need that much stuff, but then there's the ones that really do. How do you make sure that, those kids are getting tended to?
I think what we're looking at is making sure, because you can aggregate all this information, you can collect it, and the technology is there, but how do you ensure that, and as we focus today on the Medicaid population, how are you making sure this underserved population knows how to access care?
What doesn't work? Where does this disaggregation problem become a real problem versus a plus? Oh, nice looking away, Tony.
Oh, is that for me now? I was going to let someone else answer that hard question first.
No, I'm coming for you. So what about the rest of you guys? Where does it break down? What is the flaw in the separated model?
I think it breaks down when you put the patient in the middle.
You wanted to add something, I?
Can, or you can move on, either way.
Go ahead, you add something.
You sure?
You go right ahead.
All right. So I think 2 other things that I would add. One, I think the operational tactics of this are also so important. So we talk a lot about the data liberation and what have you, but we actually don't have shared care plans. The other is that we're not talking at all about all of the other systems that are fragmented. So when you start to layer in housing and food supports, and you think about all of the public benefits that folks who are subsidized in some form access, each of which are siloed from each other, let alone siloed from us, it's easier for us to do first-party data collection. And by the way, more often than not, their data are wrong. And so nobody's actually asked the question in an empathic way and listened to the answer to understand what somebody actually needs.
We believe it's so important to bring these vital conversations to you on the topic of technology, innovation in healthcare. And we look forward to bringing many more to you in the future.